motion and a second. Is there any discussion? Hearing none, all in favor say aye.
Aye.
If there's any public comment, now would be the time to do so. Seeing none, moving on to new business. Are there any claims?
Claims are prepared in front of you, sir.
I'd move to approve.
Second.
Got a motion and a second to approve the claims. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Any payroll?
We have 4 new hires, all jailers effective April 12, 2021. You'll be approving their initial PAF and their 6-month PAF. The resolution.
I move resolution 2021 number 47 on the 4 new jailers.
No second that.
Okay, we have a motion and a second to approve resolution number 47. Is there any discussion? Hearing none, all in favor say aye.
Aye.
And then I have 3 payroll changes for 3 different employees, 1 for conservation and 2 for sheriff.
Is there a motion to approve?
I motion to approve. Second.
Motion and a second. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Drainage.
Have one drainage problem recorded in Drainage District 86, Mason Township, reported by Larry Eden. Appears to be a intake is silted in, causing the water to not drain. I would recommend Rodney investigate.
I move to have Rodney McKinney go out and check this drainage situation out there taken care of.
I'd second that.
Okay, we've got a motion and a second to approve Rodney and investigate the drainage. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Looks like we've got a liquor license for Buffalo Run Golf Club.
I'd move to approve.
Motion and second to approve the liquor license. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Item number 5, county engineer. Any update?
Just a couple. One of which is a bridge replacement project on 180th. Was led on March 21st. Had a lot of interest, 10 bids. The engineer's estimate was a little over $200,000, and our low bidder was $153,000 for the project, so pretty competitive bids. And then the only other news I really had was Hawaiian Energy thinks they'll have power on at the new building site today. So we'll keep our fingers crossed for that. And that's all I have.
So is the block layer done, do you know?
I believe he is. Last I heard, I think it's mostly just getting the wire thread through the conduit and get everything installed, the electricity.
So it looks like we have to take action on the culvert replacement.
I'd make a motion to accept.
Second.
Okay, we have a motion and a second to approve the bids. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Looks like we also need to entertain a resolution authorizing the county engineer to sign the required documentation.
I move resolution 2021 number 48, authorizing the county engineer to sign the project documentation with Doc Express.
I would second that.
Okay, we have a motion and a second to approve resolution number 48. Is there any discussion?
Just one question, Casey, tying back into that, who was the low bidder?
Peterson Contractors Incorporated.
Okay, we've dealt with them before, so,
Yeah, they've done other box culverts for us in the past.
thank you.
All in favor, say aye.
Aye.
Aye, resolution carried. John, is there any dock permits?
Yeah, we have 2 this week. Elm Street, Mill Street, that's about 56 and 57 feet. And as usual, before we get it, we get the required fees, documentation, including insurance. Recommend approval vote here.
Move to approve.
Second.
Motion second to approve the dock permits. Is there any discussion? Hearing none, all in favor say aye. Aye, motion carried. Looks like we have some electrical line easements with Interstate Power.
On number 8, the line energy has requested 2 easements over on the engineering administration property. And I actually consulted with Steve O'Neill because they're going to be owning the property in a couple months. Steve went out, I believe, and met with Alliant. He's satisfied with the easement request. So we recommend passage. I think there's 2 maps in there where it'll be located. Steve drew out with everything, so that's it. We recommend approval.
I move as presented.
I'd second that.
Okay, we have a motion and a second. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. Item number 9, the 2021 recommendations regarding the soil and water conservation district. Anybody need to speak to that?
This is the annual information that the soil water conservation manages the SLU bill. They determine which qualifies and which does not, and forward that to you for approval.
Sounds good. Is there a motion to approve?
I'm gonna abstain because I have property.
I would move to approve. I'll second. Any discussion? Hearing none, all in favor say aye. Aye. 2 ayes and 1 abstention. Number 10, consider architectural fees for design of secondary road building. Tom, number 10.
Yes, as part of our process of reviewing all the engineering infrastructure, the board has looked at 2 areas in Ventura, one area in Ventura, one area in Thornton for possible new buildings. This is to obtain architectural fees for the design of both those buildings, and they're very similar, so the design costs are not as high as they normally be because the buildings are almost identical. We sent out 4 requests to 4 different architectural firms. We had 3 back. Berger and Cram with a low not to exceed fee for the design of the 2 buildings at $31,850. So we recommend approval of them to proceed with the design of the 2 buildings.
I move to approve.
Second.
Okay, we have a motion and a second. Any further discussion? Hearing none, all in favor say aye.
Aye.
Aye, motion carried. John, number 11, 12, and 13.
Certainly, 2 of the 3 updates that we received don't have to add any acres. The second one, DCI Weaver, adds about 150 approximately. There is a extra letter to express our concerns, so that is a letter for added acres that are recommended for.
I move to approve the planning and zoning recommendations on the manure management report forward on to the DNR with the addition of that notation for the Weaver site of an increase of 149.28 acres.
And I'd second that.
Okay, we got a motion and a second. Is there any discussion? Hearing none, all in favor say aye.
Aye.
Motion carried. Item number 14, April is recognized as Child Abuse Prevention Month, whereas we're going to read a proclamation. Whereas we recognize keeping children safe is everyone's business, whereas the children of the communities of cerro-gordo County are the future. Whereas the safety and well-being of children should be everyone's priority, responsibility, and duty. Whereas communities are encouraged to promote programs and activities that enable children to thrive and grow in healthy environments. Whereas child abuse has short-term and long-term effects and lasting effects on children, adolescents, developing, leading. Signed this day, April 1st, 2021. Obviously, today's not April 1st, but is there a motion to approve?
So moved.
Second.
Motion is second. Any discussion? Hearing none, all in favor, say aye.
Aye.
Aye. Brian, you want to give us a brief update where we're at?
Yeah, sure. As far as the mass vaccination clinic, we continue to do what we do. Approximately 800 doses of Moderna each week. Next week, the governor's proclamation basically opens up vaccine to everybody. So we anticipated an increase in the number of vaccines we received. So we don't find that out until now Wednesday. That used to be Monday, then it was shifted to Tuesday, now it is Wednesday. So we just take it as it comes. Some important points that we're looking at is, first of all, some good news. There was some information that came out through the New England Journal of Medicine that looked at 2 different studies related to people who've received vaccines, either Moderna or Pfizer. I'm not sure where Johnson & Johnson falls in that, but once you get out past 14 days after the second dose, the likelihood of you getting COVID is 0.05%. That's amazing. So that is definitely a case to continue to emphasize the importance of people to get vaccinated. We continue to put out vaccine slots on Friday at 4:30, on Saturday, Sunday, and Monday at 9 a.m. That works out really well, and it lets the person who works during the week access to a clinic spot. a sign-up point through the weekend, so that's working out really well. The other piece I did want to mention, testing has dropped substantially, not in a good way. The amount of tests have dropped by 1/3 in the last 2 months, so that's something else that we want to make sure that we continue to push, that people need to make sure that they're still getting tested if they come down with symptoms or they've been exposed to a known positive case. We've seen surges lately in the last couple of weeks, especially in areas like Michigan, where they're seeing the UK variant, the V117, show up a lot. They have doubled the number of cases, the daily cases in the Michigan area. So we're paying attention. There is surges happening throughout the Midwest. So we'll continue our messaging accordingly, but that's where we're currently at. Aside from some other, minor details on things that we just do on a day-to-day basis. So any questions?
I got one. So, considering this is Easter weekend for the public's knowledge, what is your schedule?
Yeah, I'm glad you asked, Chris. So we have clinics opening on Wednesday and Thursday. Again, we're closed on Friday. We have since finished our phase work, primarily for all of our teachers and our child care workers. That was the primary reason why we were having Saturday clinics. However, we are planning, we can go back to Saturday clinics and or nights. We may need to kick into night clinics, especially as people who work otherwise need to access vaccines. So the department is prepared to do that. The one thing that we're, again, waiting to see where our numbers start to go up as far as number of doses, so that we do operate with 40 to 50 volunteers in each one of our clinics, and so we like to give those people some time to at least plan their week out. So we are not open on Friday. We won't have anybody there. We will not be open on Saturday. We've only scheduled for Wednesday and Thursday of this week, and then we will return to our schedule next week. Probably if we get an increase, we'll be open on Wednesday and Friday. We're looking to see then if we need to throw in another date if we get extra doses, but we'll let the public know that. So Friday, Chris, even though we're not open, people will be able to go in and sign up for vaccine slots that would land next Wednesday and Friday. People will also be able to access those on Saturday, Sunday, and Monday morning at 9 a.m.
For the media's sake, are we in need of more volunteers, or is everybody holding steady?
Right now, we're holding steady. We are watching closely. Again, our volunteers have been through about 25 or 26 clinics now, and so they're fantastic. I can't say enough great things about them. Maybe we can name a day after just our volunteers in our community. But for now, we will definitely bring this back to our media partners if we need to start pushing out a need for more volunteers. Again, the other thing we're watching is, and I was mentioning this to Adam, is we haven't even begun to talk about vaccinating kids. If we're going to get to this concept of herd immunity, we're going to have a vaccine that's going to be available and distributable to kids. And we're not there yet, so we're watching for new information that might come out related to that. But for now, there's no information related to it. But we will, again, when we talk about the longevity of this, it's going to have to include kids at some point. And also getting vaccines to our clinics. Chris, you've asked in the past about working with our pharmacies. We've continued to have meetings with them. Walmart, we're hoping, will get a direct allocation of vaccines starting next week. We are talking with CVS Pharmacy. We're working with Mercy Pharmacy. And Mercy also communicates with some of our long-term care pharmacies to make sure that we're getting vaccine into those locations. Although we've done the long-term care centers, that doesn't mean that they don't have a changing of staff and residents, so we need to make sure that we maintain that level of vaccine availability and administration. So we continue to work on that also.
You mentioned that, but is that on the cerro-gordo public health site as far as other places where they can go?
Yeah, yes, it is.
City, but in Clear Lake also?
Yes.
Have pharmacies?
Yep.
Okay, good.
Yep, I brought it last week and didn't need it, but we do. I had a print out of the list, so people can certainly check our website, and that list should continue to grow. We hope. Right now, the vaccine vials come in 6 doses or 11 doses, and so we've had continued conversation with the hospital about how we can get those into clinics. So if you go in for your physical or for a doctor's appointment, they can just give you a vaccine while you're there. The problem with that is waste. So if you get to the end of the day and you still have 5 doses in an 11-dose vial, what do you do with those? And so Mercy is reluctant, and rightfully so. They don't want to have a whole bunch of waste. So until we get to single-dose vials or syringes that are pre-filled, I don't think we'll get there quite yet, but we continue to have those conversations with them as a partner.
Well, I just wanna say thank you for all the volunteers that are working hard to do it. And I have had my first shot, and I tell you, it was the slickest thing that I ever went through. So for everything that, as many people as running through there.
Yeah,
So,
thank you. Appreciate that. Mm-hmm.
Move to adjourn.